In this video, we're going to be discussing nirmatrelvir and ritonavir. You guys may also know this as its brand name, Paxlovid. Now, as a disclaimer, this is for information only and is not intended as medical advice. So what is Paxlovid? Paxlovid is one of the drugs that we can use to treat early COVID. As you guys will remember, there's two different classes of medications that were generally used to treat patients with COVID early on. This was the monoclonal antibodies as well as the antivirals. Depending where you live and what country you're from, there's different antivirals available, but Paxlovid is one of those. Now, Paxlovid consists of two different drugs. The first is nirmatrelvir and the other one is ritonavir. This is considered a protease inhibitor. Nirmatrelvir is the first drug, and it's what we classically think of as the antiviral to the COVID virus. Nirmatrelvir is broken down by a human enzyme, cytochrome P450-3A4, also known as the CYP enzyme. This, of course, is a pathway that many different drugs we use in medicine use for metabolism. Ritonavir inhibits the enzyme that breaks down nirmatrelvir. So the nirmatrelvir is the active agent and ritonavir inhibits its breakdown, and this has the ultimate effect of boosting the level of drug in our bodies. As you guys remember, since this pathway is such a common pathway for many of the different medications that we use in medicine, by inhibiting it, ritonavir also changes the concentration of many of the other medications that people may be on. And that's why it's important to seek a reliable drug interaction checker when using this drug, and to ensure that people do not have an interaction between Paxlovid and other medications that they're using. So how does Paxlovid work? The COVID virus binds to the ACE2 receptor and gets taken into the cell to replicate. It first releases its RNA strand, and as you guys remember, RNA is basically code for a protein. The RNA is then translated into a polypeptide strand. And as you guys remember, this initial polypeptide strand, when viruses replicate, is not functional. It needs to be cleaved into smaller fragments so that protein folding can occur. And it's really that after that folding that proteins take on a 3D shape and are able to be functional viral proteins. Now, the COVID virus uses a protease called the M-Pro protein to cleave the polypeptide into smaller strands that ultimately fold to become the functional 3D structures of proteins that the virus uses. Nirmatrelvir inhibits the M-Pro protein, so inhibits that protein that cleaves the big polypeptide strand, and that's why it's called a protease inhibitor. And that's also how it works to inhibit the replication and function of this virus. Now, what are the relevant clinical studies about Paxlovid? Certainly, there's increasing amounts of real-world data and further trials that were outside of the pharmaceutical industry that are becoming available. The initial trial that was released for Paxlovid was the EPIC-HR study. Now, this study was studied in a time before the Omicron virus, was targeting high-risk patients, as well as primarily targeted unvaccinated individuals with no prior COVID infection. They did attempt to see if Paxlovid worked in lower risk patients, but the results of that study are not available at the time of this video. And that's it for Paxlovid. If you found this useful, please hit the subscribe button down below.